you feel intense fear, intense worriness, dizziness, you have difficulty concentrating on one thing, you feel sad all the time, you feel restless, these are symptoms of anxiety disorder. In this video, I'll be discussing about anxiety, the types, the symptoms, the causes, and its treatment. So stay tuned to the end. Hello guys, my name is Julian Ude. I'm a student of psychology, and in this channel I discuss about psychological disorder and student lifestyle. There's a clear difference between anxiety and anxiety disorder. Anxiety is a feeling of worriness and fear. It's a natural response to stress, whereby anxiety is an intense fear, an intense worriness, prolonged fear. The types of anxiety disorder: we have the general anxiety disorder. This disorder is when an individual is extremely worried, has intense fear about anything and everything. We have the specific phobia anxiety disorder. This is when an individual has intense fear and intense worriness about a specific thing, about an event, about a situation. Agoraphobia. This is when an individual has intense fear and intense worriness about an environment, whether an open or closed environment, due to he or she finds it as hard to escape. So the individual is always afraid about being in any environment, both closed and open, because of the thought of not finding an escape route. Social anxiety disorder. This is when an individual has intense and prolonged worriness about being in a social environment, social gathering, due to it. This is because of embarrassment. The individual feels like he or she is going to embarrass themselves at any point, feel so anxious, they feel this extreme fear being in a social gathering. We have symptoms of anxiety disorder. Number one is dizziness, nervousness, restlessness, difficulty in concentrating, insomnia. We have appetite, you can't eat, you always lose appetite. It should be noted that these symptoms should last for at least 6 months. And if you are to say, oh, you have this anxiety disorder, you have 4 or more of these symptoms, you should have the causes of anxiety disorder. We have genetics. An individual gene could be the reason he or she has anxiety disorder. It has been shown that women has high percentage of anxiety disorder than men. Environmental factor, traumatic event, one's experience can lead to anxiety disorder. Substance use and withdrawal syndrome. This is when an individual uses certain substance. So this substance can lead to symptoms of anxiety disorder, which is the loss of appetite, restlessness, nervousness, dizziness. This could lead to symptoms of anxiety disorder, which can then lead to anxiety disorder. We have the treatment of anxiety disorder. If you have this anxiety disorder, there are 2 treatments I recommend for you. Number one is for you to meet a clinical psychologist who's going to recommend a treatment plan for you. And number 2 is self-treatment. This is when you meditate, you do breathing techniques. I hope you enjoyed this video. So